Indianapolis saw fewer homicides this year than last, but the number is still over 200. That does not include the hundreds more who were injured and survived. Tonight, our Dustin Grove looks at the toll on our doctors who treat all these victims and the unique program making a difference.
When Dr. Damaris Ortiz walks into the hospital to begin her shift as a trauma surgeon, it isn't long before she's treating yet another victim of violence.
It's almost every day.
Do you ever get frustrated?
Definitely. I mean, I've been treating trauma patients for a little over 10 years now, and it feels like nothing's changed.
So far this year, more than 750 people have come through the doors of Indianapolis hospitals suffering from gunshot wounds or other violent injuries. And of those who survive, Ortiz says too often many return with the very same injuries.
I've seen somebody who, I took to the operating room for gunshot wounds, come back within the year and not survive the next time.
So doctors here in Indianapolis have been doing something about that beyond the hospital operating room to try and cut down on this revolving door of violence. They're partnering with community victim advocates in a program they call Prescription for Hope.
Violence is like a disease. It's a public health problem, and once these patients come in and get treated, they go right back to the same environment.
So Prescription for Hope, based at Eskenazi Health, includes social workers, therapists, and others who connect with patients and continue once they're discharged by helping them with mental health or drug treatment, education, employment, and counseling. For Dr. Ortiz, this is much more than a job.
I also had a close friend who was shot and killed as a teenager in high school, and didn't realize how much that impacted me and my family for a really long time. It became more and more critical to me to impact these patients' lives.
Today, she's helping write a prescription to save them. In Indianapolis, Dustin Grove, 13 News.
Prescription for Hope is funded through grants and help from the Eskenazi Foundation.